I think people should start to seek treatment for urinary incontinence when it starts to affect their quality of life. Unfortunately, most people are reluctant to bring this subject up with their physician because of the stigma attached to it. But quite frankly, people should not minimize their symptoms and oftentimes realize that there are good treatments to treat urinary incontinence. We diagnose urinary incontinence initially by performing a thorough history and physical on the patient. That is quite important because oftentimes we can elicit the type of incontinence just based on symptoms. Our physical exam includes typically a pelvic exam and also a brief neurologic exam to assess for any neurologic dysfunction. The treatment for overactive bladder initially begins with conservative therapy, talking to patients about lifestyle modifications. We also discuss things like bowel regimens with the patient. When we move past that, if that treatment is not successful, then we're looking at things like pelvic floor physical therapy, and then beyond that, we're looking at medication and perhaps surgical intervention. We would only recommend surgical intervention after conservative therapy or first-line treatments are unsuccessful at treating the patient's urinary incontinence. These surgical interventions include things such as Botox injections or sacral neuromodulation, which are FDA approved for patients who are refractory to medical therapy.